Hello, my name is Dr. Sloan DeLuke, UCBO, and this webinar is going to be on the topic of chiropractic and mental health. You may not be aware, but what our brain and our body do are intimately connected, and chiropractic, people often think of it as impacting the spine and the back, but because of that it also impacts the nervous system and therefore can affect the brain and brain chemistry and brain hormones and brain balance. So that's what we're going to talk about today. So my name again is Dr. Sloan DeLuke, UCBO. I have a private practice of chiropractic located in Clifton Park, New York, which is upstate New York, a little bit north of Albany. I am originally from this area myself. I went to Niskayuna High School, graduated from there in 1992. Then I went on to the University of New Hampshire, graduated from there in 1996. I received a degree in zoology. I actually attended UNH thinking that I'd be interested in marine biology, but as it turns out I became interested in chiropractic towards the end of my college career. So then I went on to New York Chiropractic College, which is located out in Seneca Falls, New York, and I attended that for 3.5 years and graduated from there in 1999. Now, a lot of people do not realize that chiropractic care is a very rigorous education. It's 3.5 years going all year round and attending school from 8 in the morning till 5 in the afternoon. So it's about 25 to 30 credits approximately per trimester, and there are 3 of those a year. So it's actually like a 5-year program compacted into 3.5 years. So it is very rigorous. We are very well educated. So let's see, I graduated from NYCC, like I said, in the end of 99. I worked for somebody else, another chiropractor who was in practice, for a couple of years, and then I decided that it was time to branch out on my own and do my own thing. This is pretty common in chiropractic, that new graduates, do work for somebody else for a couple of years before opening their own practice. So I started Select Care Chiropractic. Our website is www.selectcarechiropractic.com. You can also find us on Facebook. And let's see, I started that in August of 2002, and here we are in January of 2018. So a little over 15 years. So chiropractic care, I'll just give you a little bit of background on what chiropractic care is. Basically, it's subluxation, detection, and correction. So we look for areas in the spine where the spine may not be moving very well. Sometimes people say it's stuck, sometimes people may say it's out of alignment, sometimes people may say it's off or crooked or cockeyed. Those areas happen, those are called subluxations. They can be localized to 1 or 2 vertebrae, or they can be more global to whole areas of the spine that may not be moving well. And then what we do are what we call adjustments, chiropractic adjustments. Nobody else is qualified to perform a chiropractic adjustment other than a chiropractor. It is a very specialized skill. It takes years to perfect. There are a lot of different chiropractic techniques and a lot of different chiropractic styles. So it is important to try to find the approach that works best for you. And if you do ever have an experience that isn't ideal for you, please do not give up on chiropractic. That would be like giving up on, one form of antibiotic because you got a rash from it. You just had to try a different one. So chiropractic is a lot like that. You have to connect with the doctor because it is a bit of, intimate isn't really the right word, but you are close to that person. You are touching that person. When you're the doctor, you do have to have rapport. You have to be comfortable with that person. And everybody has different energy levels and everybody connects differently. So if you find somebody whose technique isn't for you, or whose personality isn't for you, or whose office isn't for you, please don't give up. Just try a different approach, because almost all chiropractic work has helped people, but getting that right connection can take a couple of tries sometimes. So the point of all that is that no matter who the doctor is, they are attempting to locate and eliminate subluxation. Some doctors will do that with their hands, some will do it with instruments, some will do it with special tables, some will do it with other sorts of unique methods. So again, you have to find the approach that works best for you. But the nuts and the bolts of what a chiropractor does is we look to identify subluxations and use chiropractic adjustments to eliminate those subluxations. So what is a subluxation? That's, probably your next question. Well, like I said, a subluxation is the lack of normal movement. It's a restriction. It's a lack of alignment in the spine. But the bigger picture, what that does or why we care about that is because it impacts the nervous system. A subluxation is bad. It affects your neurology. It affects the way your spine and your brain communicate. And everything that happens to every cell, tissue, and organ in the body happens because the brain either received or sent out a signal to or from the body. And when the brain does that properly, the cells, the tissues, the organs all receive proper signaling. They do what they're supposed to do. They signal back up to the brain, and everything is connected and everything is working properly. However, when we have a subluxation, which we can get those from relatively innocuous means. A subluxation can occur from stress. It can occur from sleeping funny. It doesn't have to be an accident or an injury. Subluxations can occur from bad posture, from cell phone use, on and on and on, from toxins in our environment, toxins in our mind. It's just toxic people around us, believe it or not, can cause us to get tense, which can pull our vertebrae out of alignment, which can create a subluxation, which can irritate our nerves, which can affect the way our brain and body work. So a subluxation is bad for our nervous system. And our nervous system, like I said, controls and coordinates all cells, tissues, organs in the body. So when the nervous system is working properly, your brain and your hormones and your mood can be more balanced, can be more adaptable, can be more in your control, because your flight or fight mechanism is going to be under better control when your spine is in better alignment and when you do not have a subluxation. Now, there are lots of different reasons why people's nervous system can get in a fight or flight mode. Subluxation is not the only one. It is not the only cause, and it is not the only cure. But if left unattended, somebody is never going to have the same chance to heal and to get better that they would if they had their spine checked and if they had their nervous system aligned. Well, had their spine aligned, which then impacts the balance of the nervous system. So, like I often will say to patients, doesn't matter what other comorbidity you may have going on. If somebody has the same thing as you, and you both have subluxations and you get yours corrected and they do not, I guarantee you will do better. You will be healthier, you will be more adaptable, and you will recover from whatever is ailing you quicker and easier if all other things remain equal. So we spoke about what a subluxation is. We spoke about how it's about neurology. Again, the nervous system allows your body to heal, to repair, to adapt to its environment, to function, and to be its best that it can be for you. So when we have a subluxation that interferes with that process, our body just isn't going to work to its full potential. So the premise of chiropractic, and actually a lot of holistic or I guess holistic is the best word, other types of healing that doesn't require medication. Sometimes we call it non-Western types of approaches. Most of us are familiar with the medical system, which means you receive a diagnosis and then you often either get a medication, you get a surgery, or you're told to just kind of wait and watch. So other forms of health and healing, things like massage and acupuncture and chiropractic and Reiki and mindfulness and meditation and things of this nature, all kind of have one sort of underlying premise in common, and that is that the body is self-healing and it's self-regulating. And what that means is that we're born with a certain set of genetics, yes, and now we've become a certain age, so yes, there may be some limitations that we may have. However, everybody's body has the ability to heal and to regulate if we get out of its way. But if we do things in our life that limit that ability, subluxation being one of them, you're not going to be able to heal and recover and be the best you that you can be. So what we're trying to do in chiropractic is get to the root of somebody's problem, whether it be back pain or anxiety, or digestive issues, or ear infections, or a weakened immune system, or headaches, or TMJ issues. whatever somebody's issue may be, whether it's pain-based or not, we're trying to get to the root of what caused it to help that person heal holistically from the inside out. And as chiropractors, we do make other suggestions outside of the realm of just subluxation correction to help people's bodies be stronger and to help them heal from the inside out. So again, a subluxation is a barrier to that healing. As I said, it is a barrier. It's a significant barrier. It is not the only barrier. Health and healing, think of it like, aces in your deck. The more aces you have, the more wellness you'll have. If you lose an ace, you can still do okay. If you lose another one, it's starting to get tougher and tougher. So what we're doing through chiropractic care is we're adding aces to your deck. And who couldn't use a few more aces, right? So, you may be wondering, okay, I think I get that. That kind of makes sense, but my back doesn't hurt. I'm here, I have stress, I have anxiety, I have depression, I have other mood disorders. I still don't understand why chiropractic may or may not help me. So let's talk about pain, because everybody knows that yes, chiropractor is a great way to treat pain. Let me just put a little caveat in here. In the opiate crisis that we're currently experiencing in our country, chiropractic, which does not prescribe medications, does not advocate for the use of medications, is one of the best, safest, most effective, and least expensive forms of pain management that exist. It has very, 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 very low risk factor. Pardon me. So, please, before trying any kinds of pain medication that your doctor may give you, please look for a natural, holistic approach first, because you just never know if, that medication you took for your back pain is suddenly now going to send you down a path to, unfortunately, opiate and then heroin addiction. So chiropractic plays such a huge role in a holistic, natural, drug-free life that I don't think anybody can work to their full potential if they don't get their spine adjusted and corrected. So let's talk about back pain. So we all know that pain, or any sort of pain, headaches, neck pain, whatever it may be, is a huge trigger for depression, when it's chronic especially, huge trigger for anxiety, discomfort, it just becomes so exhausting to deal with chronic pain. So whether you're somebody who is maybe vulnerable to depression and anxiety or has never experienced it until you had pain, pain is going to just wear and tear at your nervous system and at your brain and at your moods, and is going to break your body down. That when you have pain, the neurons are just firing so quickly into your system, and they're just causing more irritation and more imbalance. So if we can decrease that pain, we are actually decreasing nervous system irritation. And that is a huge stress relief for people. It's going to give them a sense of well-being, a sense of peace. They're going to feel better. They're not going to have anxiety and depression related strictly to pain. The adjustments are going to help the brain settle down. Again, it's going to take the edge off of anxiety. It's going to give people hope, take the edge off depression, because when somebody's in chronic pain, you just begin to wonder when you're ever going to feel better again. And again, that chronic irritation can affect our moods, even if we're generally a happy person. Mood, of course, as we all know, is regulated by body chemistry. Complicated, it's not easy, and it's not simple, but one contributor to body chemistry is certainly lack of subluxation or subluxation. So if our nervous system is working properly and it's signaling properly between the brain and the body, and subluxation is reduced, then that potential cause of anxiety, of other mood imbalances and disorders is going to be reduced. So again, for everything to work properly for mental health, you need the spine to work properly, to function optimally, so that the neurotransmitters and the hormones that your brain and your body are supposed to make and use to communicate and to function ideally are able to happen, that everything's able to work like it was designed to. Again, there's a lot more that goes into, mental health issues. It's not just subluxation. I certainly don't mean to say that, no need for therapists, no need for medications, no need for self-regulation. Just get adjusted and all will be well. If it was only that easy, that would be fantastic. Like I said, this is the ace in your deck. And it's safe, and it's inexpensive, and it works and it helps your body in so many other ways that there's really just no downside. So everybody experiencing any kind of mental health issues, give yourself that little extra edge. Chiropractic may be the 10% that puts you, 10% happier, 10% more successful, 10% less depressed, and we all know the far-reaching impacts that may have on your life and the lives of your loved ones. So, if we've kind of gotten outside of pain, we've talked about how, we've talked about how mood is regulated by body chemistry, and the brain and the spinal cord need to work properly together, subluxation free, for body chemistry to work properly, for body chemistry to be functioning at its best. An adjustment also regulates the sympathetic nervous system. Again, so it controls that fight or flight mechanism of the brain. Again, especially with chronic anxiety, people are just in a heightened state, or people who have anger issues, or in a heightened state of irritation. So it doesn't take much to put us over the edge, right? Somebody drops their Cheerios and all of a sudden it just completely ruins your day. However, if your brain is more balanced because your sympathetic nervous system is not in overdrive, somebody drops the Cheerios and you go, well, that stinks, but okay, moving right along. So again, with chiropractic care, it will take the edge off of your sympathetic nervous system, meaning you won't be in fight or flight mode. You won't be anxious, you won't be angry. And it'll take a stimulation to be larger before anxiety takes hold and before anger takes hold. So chiropractic adjustments, simply put, reduce the stress of the fight or flight system by balancing the sympathetic nervous system. How cool is that, right? Okay, so let's see. We've talked about how adjustments help the body. They also help the body adapt to stress, to external stressors, like I was just saying, but internal stressors as well. So bugs and viruses and things that make us sick, foods that we may eat that not be the best for us. If our body is more adaptable, we can handle more things, and it can have less of an impact on us in the short term. That's not to say that we want to keep allowing toxins into our lives and into our bodies, because we don't, because those toxins will eventually wear us down. But in the short term, our body is designed to be able to handle stress, to deal with it, and then to get rid of it and to move on. It shouldn't lock us into negative patterns. It shouldn't trigger stress and anxiety. It shouldn't make us want to stay in bed for days. I think somebody who has good mental health still experiences a lot of the same stressors as somebody who maybe struggles with some mental health issues. The difference is that person shakes it off. Maybe they only wallow in it for 5 minutes instead of 5 days. But those things are skills that can be learned, obviously, through therapy. We know that some medications can certainly help to take the edge off of all kinds of mental health disorders. But what we want to help people do while they're doing therapy, while they may or may not be on medications, is to get the body balanced from the inside out so that it works better. It feels better, it adapts better, it functions better. Let's see, we also find that when people undergo chiropractic care, because they do start to feel better mentally and physically, they may then start to exercise. And we know the impacts that exercise has on all kinds of mental health issues. The other thing that plays an enormous role in our mental health is our diet and our nutrition. Well, if we're feeling lousy and we're in pain and we're depressed and we're anxious and we're stressed, probably not going to make the effort to go to the store to buy real food, to cook it. It's just not going to happen. But when people start to get adjusted, they get chiropractic care, their body starts to work better, they begin to exercise, as I mentioned, and then they also begin to eat healthier. And then they find that they may reach out a little bit more socially. They find that they may sleep better. They get sick less. They take fewer medications, and on and on and on. The body becomes more balanced. The body works better. You may recall what I said earlier on, is that the body is a self-healing, self-regulating mechanism. We're designed to survive. we've made it this long. We've overcome a lot, right? As a person ourselves and also as a species, we're designed to survive. So what we want to help people do is put as many aces in their deck as they possibly can so that survival is easier. It's not a struggle. And, unfortunately, it can't all be found in a pill. A lot of the changes that people really need to make to get true health and wellness do have to come from the inside out. But chiropractic is a fantastic way to help facilitate that process because, like I said, we're balancing the brain and the nervous system. We're making everything work better. So you're going to have a little bit more energy, a little better outlook, a little bit more clarity, a little bit more sense of well-being so that now you're able to do other things that you need to do to make yourself healthy. I did start to touch on nutrition, and when I have a patient come into me as a chiropractic patient, like I said, whether they've come for back pain or neck pain or headaches or stress or digestive issues or immune system issues or, any number of disc herniations or what have you, I try to take a holistic approach and recommend what I know may help that person from my toolbox. I don't have all the tools in the world. I have a good number. And then when my toolbox kind of runs dry, I try to help people, find the next provider who may have additional tools or different tools that then adds to their success in healing. But nutrition is a really big one. We are what we eat. Our brain chemistry is so intimately connected to what we put into our body. Think about it. If you were a car, a high-end, fancy pants car, and you put the worst gas, the worst fuel, the worst oil, took it to the worst mechanic in town, you're not going to get the same performance out of that car as if you did all the best for it. So you are your body, you are your age, you are a product of your life to date, you are your genetics. These things are not changeable. But given all of that, we can do so much today and in the future to actually make the body that we have function better, feel younger, have a better sense of well-being, and work better. Promise, it works every time. And one of the biggest ways to start is with a couple of basic nutritional supplements. Big one that I recommend to all of my patients in chiropractic care at Select Care Chiropractic is fish oil. A good quality fish oil that's mercury-free, that's toxin-free, that is cleaned and purified and processed properly. My gosh, it just does so much for the brain and the nervous system, and that really is what chiropractic is all about. So anybody with any sort of mood issues absolutely has to be on some of these omega-3 fish oils. Another thing that we may look into for people, particularly with any kind of mental health issues, is the gut probiotics. So we got to get the good food in, stop putting the junk in, and use some probiotics to get that gut recolonized. Because there's a huge brain-gut connection, and a healthy gut is essential for a healthy brain. The other thing that chiropractic does, because the nerves from the spine ultimately go to all the cells, tissues, and organs, if the gut is out of balance because of the back, when we correct the back, we often will see people's digestive systems start to improve and things work better. So with some chiropractic adjustments and some probiotics and a better diet, a little bit of water and a little bit of exercise, it's amazing how much mental health can improve. But like I said, nutrition is complicated. There's a lot to it. There's a lot more than this webinar is all about. But I wanted to start to plant those seeds that to get the brain to work properly, we've got to remove the toxins from our food supply, and we've got to eat good, clean, real food. Medications, as I said before, I touched on, they do have a place in mental health. And, as a chiropractor, we neither prescribe nor unprescribe medications. We just try to get the body to work better. And when it does that, and we teach people about some great, lifestyle choices, sometimes they don't need as much medication. Sometimes they don't need any medication. Sometimes they need to modify their medication. So, if you're somebody who's trying to avoid medication particularly, got to go see a chiropractor, because I can't even tell you how many medications are not necessary if you clean up your lifestyle and you clean up your spine and your nervous system. And I can help with that. I do it every single day. Lifestyle changes, again, as chiropractors, we have more education and training in this than your medical doctor does, and this is no disrespect whatsoever against the medical doctors, but let's be honest here. What their goal is to diagnose you and then locate a medication that's going to help your body change its body chemistry and change a lot of factors on your blood work, let's say. Or maybe they're going to be doing a surgery, or maybe they're going to be telling you, let's wait and watch and see when things get worse. Well, what chiropractors do is we don't do any of those things. Now, there's a time and a place for those things. They're not better than us, they're not worse than us, they're just different. And a true healthy person is going to have a medical doctor who they'll see regularly. They may even entertain some medications short term if necessary, but they're going to clean their life up from the inside out. And that means diet and exercise and sleep and chiropractic care and meditation and all of these amazing things that are so powerful because they actually heal you. That's where healing comes from. It doesn't come from a bottle or a pill, I'm sorry to say. Healing comes from you. So when we think of a baby, right, and a newborn baby, the baby can survive just fine. What do you need to give it? You need to give it food, healthy food, milk. You need to give it rest. You need to give it love. You need to give it peace. You need to give it safety, right? These are all the things babies don't really need to exercise, but as all of their actions and moving around, believe it or not, is a lot of exercise for them. So why does it change when we get older? Why is it something when we get older that all the things we would have done to care for a baby suddenly don't seem important, and we just say, oh, I'm just going to take more medicine and sit on the couch and complain? If you did that to the baby wouldn't be healthy either. So I think this is extremely empowering. It means we're not a victim. We're not a victim of our circumstances. We're not a victim of our environment. We're not a victim of our genetics even. The only thing we're a victim of, unfortunately, is our own lack of desire that we may have to make some changes. So if you are ready to make some true changes, to get control of your health, to stop being diagnosed with diseases, to stop being told you have disorders, to really regain your health and your wellness, you have to see somebody in the holistic field. You have to try a chiropractor. You have to try maybe a functional medicine doctor. Functional medicine is amazing. It's a great balance between mainstream medical care and holistic care. You really need to look at meditation and mindfulness, water, clean, pure water, all of these things, exercise, diet, stress management, proper sleep, proper control of the stimulation that we let into our lives, whether it be from electronics, from people around us, from our environment. It all matters, people. It really all matters. You got to trust me on this. So when you go to a chiropractor, yes, we can just crack your back. And yes, we can make your neck feel better. And we do. A lot of times that is all we do, because that's all people want. But if people want more, if they really want to be healthy from the inside out, if you go to a chiropractor and start asking some of these questions, this is what we do. This is why we do what we do. It's not just about back cracking. It's about the nervous system and balancing the nervous system, helping the body heal from the inside out. And chiropractic is safe, it's gentle, it is effective. Communicate with your doctor, please. If you like something or don't like something or feel uncomfortable or have questions, any good chiropractor is going to take time to listen to you, and is going to modify what they're doing or explain why they can't modify it, but they're going to take the time to listen and to specify care just for you. So chiropractors are well educated. Again, most of us have 4-year degrees, then we went on to additional school. It's a professional degree, it's a doctorate level degree, and most chiropractors live and breathe what they do. It's not a 9-to-5. We treat our kids the same way that we recommend that our patients be treated. So it's if you're looking for real balance from the inside out, please see a doctor of chiropractic. Again, thank you so much for paying attention and watching this webinar. I really hope that I was able to convey that the brain and the body are connected, and adjustments and chiropractic care have a huge role to play in mental health, balance, and awareness. And my name again is Dr. Sloan DeLuke, UCBO. I'm the owner and a practicing chiropractor at Select Care Chiropractic, located in Clifton Park. Our phone number is 518-373-6545. Our website is selectcarechiropractic.com. You can also find us on Facebook as well as other social media. And I think that's going to do it. Thank you so much. Best of luck. Stay happy, stay healthy, and give chiropractic care a try. You won't regret it.